So, good day, everyone. So, before we start, I would like to introduce myself. I'm Shen Winnie Palacios from BSN 1A, and today I will be discussing about scabies. Objectives. By the end of the session, learners will be able to define what is scabies, explain how scabies disease affects human, recognize complications caused by scabies, identify continuously the signs and symptoms of scabies disease, and describe how treatment of care and medication should be applied and undergo. Develop health education, plan activities on prevention and control of scabies disease. A brief history of scabies. Known in animals as mange, and the disease has been described since ancient times. Scabies was described in the Old Testament and also by Aristotle in the 4th century BC. Archaeological evidence and Egyptian hieroglyphics suggest scabies has been irritating to mankind for at least 2,500 years. It is known in Europe as either the itch or gale and commonplace in areas of filth and poverty. Celsus, a physician in ancient Rome, coined the term scabies to describe this condition. Scabies is derived from the Latin word for scratch. The mite was described in early scientific treatises in 1100 AD, but the connection to the human disease was not made until 500 years later. So, what is scabies? So, scabies are eight-legged human itch mite. Human scabies is parasitic infestation caused by Sarcoptes scabiei or scabiei, var homonis. An estimated 200 million people worldwide suffer from scabies at any one time. Scabies infestation look like small red pimple on the skin. The bumps may be crusty and they may also be accompanied by burrows or thin gray-brown or red lines that irrigate the bumps. They may be hard to see and can look like scratch marks, and it cannot be seen with the naked eye and passed on by physical contact, especially skin to skin contact. Three types of scabies. There are only one type of mite that causes scabies infestation, okay? These mites can cause several types of infestation. The typical scabies, nodular scabies, and Norwegian scabies. The typical scabies is the infestation and the most common. It is caused an itchy, a rash on the hands, wrists, and other common spots. However, it doesn't infest the scalp and the face. Nodular scabies is the type of scabies that develop as itchy raised bumps or lumps, especially in the genital areas, armpits, or groin. And lastly, the Norwegian scabies is the more severe and extremely contagious types of scabies. Who is at risk? People from all walks of life can get scabies, but it is most common in infants, children, mothers, old age, poor nutrition, crowded living, and persons with chronic health condition. Scabies can spread to the other people in your home, and it's common in crowded places that may have lots of skin contact, like just like nursing home, prisons, and childcare places, and so much more. You can sometimes get scabies from sharing an infected person's cloth, towel, or beddings. Other risk factors for scabies is having physical or sexual contact with someone who has scabies. To add further information, human immunodeficiency virus and acquired immunodeficiency syndrome or HIV/AIDS will be the most common disease triggering crusted Norwegian scabies. Scabies should be suspected in any atypical itching or rash in HIV/AIDS patients. Possible complications: the septicemia or the sepsis, heart disease, beta hemolytic streptococci, and chronic kidney disease. The severe itch can lead to constant scratching with non-stop scratching. An infestation can develop, and non-stop scratching can even lead to sepsis or sometimes life-threatening condition that develops when an infection enters the blood. Okay, the sores sometimes become infected with the bacteria on the skin, such as beta hemolytic streptococci, and this bacteria spread by having direct contact with an infected person, by using a contaminated object, or by inhaling infected infected droplets. This appears by sneezing or coughing. Skin infections are common, but the bacteria can spread through the bloodstream and infect distant organs. Okay, this is a crusted scabies. Okay, and this is scabies located on the patient's wrist, and scabies on infants. Signs and symptoms: itching, rash, sores, thick crust on the skin. In itching, it is mainly at night, and itching is the most common symptoms. The itch can be so intense that it is keeps a person awake at night. And rash, many people get the scabies rash. This rash causes little bumps that often form a line. Okay, the bumps can look like hives, tiny bites, knots under the skin, or pimples. Some people develop scaly patches that look like eczema. And sores, scratching, the itchy rash can cause sores. An infection can develop in the sores. Okay, thick crust on the skin and crust form when a person's develop a severe type of scabies, which is the Norwegian or the crusted scabies. So, how scabies tested for diagnosis? Scabies are usually diagnosed by the patient's history and physical examination of the lesions. Bumps and other tests that may be done include skin scraping to identify the mites or eggs, and dermoscopy, which use handheld dermoscope to allow closer visual examination of the skin to look for the mites. And lastly, the adhesive tape test, in which a doctor uses strong adhesive tape applied to the skin lesion and then pulled off and viewed under the microscope to check for the mites. Where does scabies live? Scabies can live anywhere on the body, but some of the favorite spots include between the fingers, the folds of the wrist, elbows, or on the breast or genitals, and the head, neck, face, palms, and soles in very young children. Okay. Treatments for scabies: cream application, oral medication, and antihistamines. So for cream application, there are no over-the-counter approved treatments for scabies. A doctor must prescribe treatment. A first-line treatment may involve topical cream such as permethrin, which is applied directly to the skin from the neck to the soles of the feet. Should be left on overnight, and when washed off, 8 to 14 hours later. Other topical treatments include crotamicton cream or lotion, and lindane. Lindane is not usually used as a first line treatment due to the risk of seizures. Okay, the oral medication is, in some cases, oral ivermectin may be used, particularly in cases where scabies covers a large part of the body and it's crusted. Okay, it is also often used in settings such as nursing homes, where there may be a widespread outbreaks. The advantage of oral ivermectin are that it is easy to use and it is not cause related skin problems. However, oral ivermectin can cause unwanted side effects, so it is not always the first choice treatment. And lastly, the antihistamines. It is to get relief from the symptoms of itching. Some over-the-counter antihistamines such as diphenhydramine may help control the itch and allow patients to sleep. So, preventions and control. Scabies is prevented by avoiding direct skin to skin contact with the infested person or with items such as clothing or bedding used by infested uh, person. Scabies treatment usually is recommended for members of the same household, particularly for those who have prolonged skin to skin contact. All household members and the other potentially exposed persons should be treated at the same time as the infested persons to prevent possible re-exposure and re-infestation. So, bedding and clothing worn or used next to the skin anytime during the 3 days before treatment should be machine washed and dried using the hot water and hot dryer cycles be dried, cleaned. Items that cannot be dried, cleaned, or laundered can be disinfested by storing in a closed plastic bag for several days to a week. Okay, scabies mites generally do not survive more than 2 to 3 days away from the human skin. Children and adults usually can return to school um, or to childcare, school, or work that they the day after their treatment. Okay, and that's all. References. Thank you for watching.